Allopathic medicine serves to dominate an organ or tissue system, where in naturopathic practice, you're working with the whole body. You're utilizing perhaps vitamins, you're instructing the client to bring exercise into their regimen of life practice. You're talking about foods, you're talking about water, which many times people do not drink any water at all. And I'll lecture them about the cell being 75% water. One would want to be at balance in their life. Balance being eating well, exercising, having a positive mental attitude about your life, prayer, being in the field that you're suited for.
Anybody that I've sent, they say the same thing, and then they go, and oh my gosh, it's so wonderful, or it's working.
Rather than trying to take a pill or a shot, you actually look to harmonize your body. Look for the things that you're doing right, but look at the things that you're not doing right. And so a person like me is going to be viewing that, listening, watching, and then trying to suggest a different protocol, if you will, to help them get through their day, get through their life, go on, turn people around to live a better, balanced life, a meaningful life. And that's my hope for anyone that comes through this door. That's what my role is here.
See, I think the most important thing about Dr. Mastro, he's not just generically treating you, he's treating you as an individual.
What he does for me, the medical profession could not do.
I guess medicine today is a little bit different in that it just treats a symptom. He treats the reason why you're not feeling well.
So you decide that you're going to see a physician, and you go to your physician, and they prescribe a pharmacologic, some kind of relaxant that's a chemical. Well, you've never taken any chemicals, you've never used pharmacologics, and when you take it, it makes you drowsy. And now you have a chemical entity that's creating something that's a malfunction in the body, not physically addressing the actual injury. You didn't seek out physical therapy, you maybe didn't seek out chiropractic, or maybe didn't come to a naturopath to find a remedy to help the body heal. And that's where I come in. When people have an issue, they want to unmask the cause. They don't want to just take a tablet and make it go away, because making something go away may not be the issue of removing the cause. I like to design a whole protocol for a particular client or patient that comes in. And I usually do that based on their lifestyle. What do they do for a living? I always ask them, what do you do? What is your profession? That leads me into understanding them. It tells me and shows me what kind of stresses might they have.
It's specific for your body, not for a general population.
There has to be synchronicity. We all know when our body's not right, don't we? But oftentimes we seek the most radical treatment rather than unmasking the cause, as I said earlier, of that problem. This is not medicine. This is the philosophy of naturopathy versus allopathic medicine, which uses pharmacologics. So the mechanisms that are used here are not pharmacologics. They're either herbal-based, vitamin-based, or homeopathically based. And so they're going to come here, and they're going to look for a way to clear the body. When I say clear, I mean actually clean it from inside out.
Our energy levels are really high. I mean, and I can compare them to some younger people going, But I think it has more to do with all the remedies.
The remedies are vibratory. If I take this, I've just activated this marvelous remedy, because there's molecular energy here, just like there's energy here. Sure. These are all energetic.
He'd get them off a lot of the medications that they're on that are making them sicker, that they have to figure out another medication to counteract the medication that's treating something, that's only making them sicker.
So they're not destroying the body, they're subtly energizing it. It's like getting on a motorcycle and jump starting it. And it goes, if there's points and plugs and gasoline. But if there's no gasoline and no points, it doesn't go.
I've sent him many, many patients that have had chronic things like Lyme's disease, or say issues of focusing, children with focus issues. Mastro has helped every one of the people that I've sent him in a very positive way.
It wasn't magic. It took time. But as I aged, instead of my health declining, my health improved, which, I think is an amazing thing.
It's the healing care you give the patient that matters. If you can do that first and don't worry about money and don't worry about any other thing in this life, you're going to help a person that needs your help. And that's the greatest thing, and that's what we're here for. If we can't do that, what the heck are we here for?
No doctor has ever spent that much time with me. And right from that moment, I felt so special. If there were an Olympic event for a healthcare provider, Dr. Mastro would bring home the gold. He really would.